Hey guys, Dr. Morse, injury experts. So let's talk about someone who I've been getting a lot of questions about, rightfully so. Someone I was really high on coming into the season, and now he's been struggling. Brian Thomas Jr. Now, he finished as the wide receiver 4 last year after absolutely destroying expectations after being taken late in the first round. Now, the majority of his work last year was done with Mac Jones. But the expectation was that Liam Cohen was going to come in and put Brian Thomas Jr. in the slot, which would basically mimic what Chris Godwin did last year early on before he had his injury, and that would just accelerate him to the next level. They drafted Travis Hunter Jr. to be the other elite wide receiver next to Brian Thomas. The problem is it hasn't worked out yet. We heard about 2.5 weeks ago that Thomas was dealing with a wrist injury, but we've never heard any specifics. They said, oh yeah, he was dealing with a wrist injury before this. He's been playing through it. He's been on the injury report ever since, and now I want to shed a little bit more light on it about what this could possibly be. If this was super mild, it would have already resolved, and we wouldn't be talking about it anymore. But the fact that it's still relevant, it looks like it's still affecting him. He's dropped a ton of passes. He's got what I call the yips. And this is essentially where Trevor Lawrence throws a hospital ball across the middle of the field, and you see him kind of pull back and say, no, I'm not going to get smashed across the field. That has then led to a lot of mental issues that he just doesn't trust where Lawrence is throwing the ball. If you look at where the data for the stats for him throwing Hunter and Brian Thomas Jr. the ball, they're awful. Whereas Parker Washington and whereas Brenton Strange, the data for them is much better from a Trevor Lawrence perspective. What is Brian Thomas Jr. potentially dealing with? My main concern here is something called a TFCC sprain or tear. Now, the TFCC ligament complex is on this side, the lateral side of the wrist. It's in this angle right here, and it's responsible for twisting the wrist. Now, I usually describe this to my patients as turning a doorknob. Does it hurt to turn a doorknob? Now, this complex, TFCC, stands for, the T is triangle. Now, this is a triangular structure, and the middle part of the triangle is something called a central slip or a central disc. Now, the problem with this disc is that it's tiny, but it's very important. And if it's partially torn or fully torn, it doesn't heal. I inject these with stem cells, but these are very difficult to stabilize because there's a lot of moving parts in the wrist. And every time you twist your wrist, those bones want to rotate. And the TFCC is basically trying to prevent that. Well, if this thing is sprained, every time he tries to reach out and rotate his wrists, that's going to click. And that's going to give him a zinger, and that's going to cause instability. That may be a lot of the reason why he doesn't feel comfortable catching the ball in certain positions. Now, this could be a scapholunate ligament injury. That's my guess is what Tyreek Hill had last year, if I were to guess. We don't know. My concern here with the TFCC is that unless they can get this stable, this isn't going to resolve or heal until he has surgery. Yes, they can put cortisone in there. Yes, they can put a brace on it, but this ligament doesn't heal well by itself. And as a result, he may continue to struggle with this. Yes, he's technically going to be full in practice, but that doesn't technically mean he's 100%. That just means he can do everything they're asking him to do. But the fine motor skills and intricacies of the wrist, if this ligament is torn, are concerning. You know, there's many other possibilities, but this is one of the things that I have significant concerns about, and I finally decided to voice my opinion. Now, hopefully, he's able to get this under control, and he smashes for the rest of the year. Maybe we get some clarity from one of the beat reporters or something to say, hey, what exactly are you dealing with, and how should we approach this? But nonetheless, that's my initial thoughts on Brian Thomas Jr. heading into week 4, still dealing with this wrist injury. I'm starting him if I have him because his upside is so high. But I want to hold my breath every time he catches the ball or drops the ball because of this stupid wrist injury. Let's hope for the best. I'll give you an update when we know more.